Great day, Hampton Roads. You're watching We Care, a weekly interactive discussion about healthcare in Hampton Roads, Virginia. I'm your host, Quwania Jefferson. Today we're discussing men's health, COVID-19, and more with healthcare professionals on the front lines. Our first guest today is none other than board-certified Family Nurse Practitioner Meno Kouakeu, who brings over 10 years of clinical experience providing a passion for high-quality, comprehensive health care for individuals of all ages and races throughout the community. Welcome, Meno, and thank you for joining us.
Thank you for having me.
Absolutely. So we're going to dive in. So we know that this month has a few national awareness campaigns or observances, if you will, and one of those is Sexually Transmitted Infection Awareness Month. Absolutely. Did I say that correctly?
Yes, ma'am.
All right. So I've heard of STDs, which is sexually transmitted diseases, but more recently I've been hearing more about STIs. So can you tell our viewers, is it one and the same? Is it the same thing or?
Okay, so these terms are very similar. So, back in the day, we did use STD, standing for sexually transmitted disease. The term sexually transmitted infection as of recently became more popular because it became more specific to a patient's actual diagnosis. Both, of course, are conditions that are caused from sexual activity, but a sexual transmitted disease is what it is. It's a disease. It's a disease that is caused by a sexually transmitted infection. So typically, once you're at the point of disease, typically you're having symptoms, or the condition is, there where you have to be treated. It's not something that doesn't clear up on its own. Sexually transmitted infection, you don't need to have a sexually transmitted disease to have a sexually transmitted infection. So sexually transmitted infections are the precursors to sexually transmitted diseases, but not vice versa.
Got it.
You can have an STD, you can have an sexually transmitted infection, have no symptoms, doesn't mean it does not need to be treated, but you can have a sexually transmitted infection that can clear up on its own, like HPV, or you can have a sexually transmitted infection that does need to be treated. Either way, sexually transmitted, you still need to get screened for both, and then your healthcare provider, of course, will kind of guide you in the right direction. So,
Awesome.
Yeah. So that's the difference. And we do it more so just to be more, again, like I said, more specific to a patient, just to make sure that, they're in the know about what is actually going on with their body, and to kind of break up that fear component. So,
Okay. That's some really good information. Because, when you're not, for people like myself who are non-clinical, to hear those acronyms used interchangeably, it could set up a little bit of confusion.
Absolutely.
So thank you for clearing that up. And just so that I'm making sure that I understood it correctly, you can have an STI without having an STD, but an STD cannot exist without a precursor of STI.
Yes,
So
ma'am.
basically the STI grows into an STD when left untreated.
Absolutely.
Okay, well, I think that pretty much narrows that down. So do we have a population who is more at risk? Would you say that women are more at risk than men or vice versa? Or is there an equal level of risk?
Well, I'm going to say that they both are, skyrocketing, very high. The rates are still increasing. But men and women, it's almost neck and neck, but women tend to traditionally have higher rates than males, just from a standpoint of our anatomy. We have more openings that give us more of give infections more of an opportunity to, take over and invade those cells. So, based on that alone, that's why women tend to have a higher rate.
Okay. And so when we're talking, now that we've said, okay, women do have a higher rate, if a woman gets pregnant, should she have a great concern about contracting an STD or an STI? Or, does a pregnant woman have a higher risk?
So a pregnant woman does not necessarily have a higher risk for contracting an STD or STI. One good thing about a pregnant woman is if she is receiving prenatal care, she's going to more than likely be screened for that automatically and be at less risk for an STI or STD to go undetected, number one. Number two, it's not necessarily that a woman or a pregnant woman gets higher risk for STDs. It's just an extra concern for a pregnant woman because as opposed to you having a woman who's not pregnant, she's dealing with the infection or the disease alone. Now, these pregnant women have a very significantly high risk of transmission to your unborn, child. Which can put you at risk for miscarriage, congenital deformities or issues, in your child. So definitely, that's why we automatically screen women, for STDs or infections once we find out that they're pregnant.
Wow. So now it's starting to really come together like a puzzle for me. Mm-hmm. And I'm sure our viewers are starting to say, oh my God, like having an aha moment, if you will. So women are slightly higher risk, and then pregnant women have their risk is compounded by the fact that they're pregnant. Would you say that, or am I? Because they're being pregnant and possibly contracting an STD or STI could lead to developmental issues with their unborn, or?
Yeah, so I could say that the chance of them getting an STD or STI is not increased because they're pregnant, but the fact that they do have an STI or STD is of extra concern because now we're dealing with potentially having a woman and, a child. It's a complex case now. We're not just treating a patient. Now we have to worry about with medications, certain medications, is this safe for pregnancy? Is this not? So that's when it makes the situation definitely way more complex.
Wow. So that's totally, never would have even thought about it that way. So that's some amazing information that I think women in general just need to know.
Southeastern Virginia Health System and Hampton Roads Community Health Centers have partnered to provide primary care for you and your family.
Accepting all patients, whatever their insurance status. We're your patient-centered medical home. In office, online, or via phone. We're dedicated to safely meeting your healthcare needs.
Throughout Hampton Roads, wherever you live, work, or play, we provide high-quality, comprehensive, and affordable services.
Because we care, so you can be healthy.
So are there any real effective ways to not get an STI or an STD?
Well, of course, we all grew up with everybody saying the best way is, not having sexual activity. I think it's important also to kind of understand the definition of what sexual activity is. Any sexual activity can place somebody at risk for contracting an STD or STI. So we're not just talking about penetration, but, there are STDs or STIs that are contracted through just skin-to-skin contact. So I think people need to take that into consideration. So the best way is to not engage. A lot of people are sexually active. So best way is use protection every time. I don't really care if, you're in a monogamous relationship. It's just best practice. get screened and tested routinely. That's the best way to prevent an STI, or if we find it, that's the best way to, we find it, we treat it, and that will prevent the spread of them. And basically just, be in the know about your body, if something's going on with your body or different about your body, call your provider and we'll take it from there.
Well, that's exactly why we're here today. The mission of Hampton Roads Community Health Center is we care so you can be healthy. And I think a lot of times it can come across as a cliche, but when we have an opportunity to speak with some of our providers that are on the front line, it really makes it all come together, that these individuals truly do care, not just about where they work, but they care about who they're serving. And in this instance, Hampton Roads Community Health Center is serving patients of various backgrounds and demographics. So it's great to know that someone such as yourself has such a vast knowledge of how to prevent as well as treat STDs or STIs for patients, So it's really, I was hearing you talk about the different ways of preventing it. So you're saying abstinence would be probably the top. But if we're honest, in society today, abstinence is
Unrealistic.
It's unrealistic across the board. So then we talk about preventative measures such as
we call it barrier protection or barrier methods. Barrier methods, the most common we know, male condoms.
Okay.
A lot of people, use the excuse, male condoms, we don't use them because they're allergy or allergic to latex. There are a lot of alternative, materials that are used now for condom use. Lambskin,
really
plastic, They are a little bit, just a tad bit more expensive, but honestly, it's something that's provided by our facilities. Any health department, we provide both alternatives for patients to have. And then you have other barrier protection, female condoms. You have still people use dental dams. Basically, it's a barrier protection, a barrier method goes in your mouth, and those are for people who engage in oral activity. So that can prevent somebody from getting a sexually transmitted infection via the oral route. So that's the best way. Big misconception, I think a lot of women forget that birth control does protect you from STDs. It does not. Birth control has nothing to do with STD prevention. So you just need to take that into consideration.
So it's funny that you would say that, because I have heard people say, I'm on birth control, and they look at that as kind of a all-encompassing form of protection. But for clarity, birth control is designed to prevent unplanned pregnancies.
Absolutely.
And then the barrier methods you mentioned, whether they are male or female focused or oral focused, those are utilized to prevent the spread of STD or STI.
Absolutely.
So this is really good information, because, it's not a day-to-day conversation. And I think that's kind of what happens, and there gets to be this speculation of what you can and can't do or should or shouldn't do from a sexual perspective. And so to have you sitting here sharing this with our viewers today is very important.
I'd like to add one more thing.
Absolutely.
This is 2021. Another thing that a lot of people don't think about, sex toys. We forget about those, and preventing spreading infection. Any of those devices or toys that are used, some people aren't cleaning them properly, or they're sharing them. So that's something also we need to be considerate about. Just properly cleaning. Those are because, technically if somebody has an infection, they're using that, and sharing it with other people, potentially something could spread. So that's something, it's 2021, people use those. So that's something we need to be mindful of, making sure that's proper cleaning with that.
Oh, wait a minute, I'm sorry. I hear the producer in my ear saying, close your mouth. So for clarity, you're saying that sexual toys, when used in the act of sexual engagement, could be a source of spreading STD or STI?
It could be a vehicle, absolutely.
Wow.
The chances are a little lower, of course, technically, but definitely. I mean, if it's used during, absolutely. So you just want to make sure that, you use proper hygiene before and after use of it, or you just don't share it at all with anybody.
Well, I tell you, I know my producer is going to kill me
But
because
these are conversations we have with patients, and that's just, it is what it is. So
I would love to go to my doctor's office and
Absolutely.
just sit and have this type of conversation from an informative perspective so that I leave feeling equipped
absolutely.
in my own personal life. So my mind is totally blown as we sit here with Meno Kouakeu right here on We Care.
Today is an exciting day at Hampton Roads Community Health Center because we are giving vaccine shots to first-timers and second-timers through the generous contribution and distribution through the Virginia Department of Health. So we are vaccinating for the COVID-19, and we're anticipating that we're going to see almost 300 people today that are getting these much-needed service. We are thankful to be here because this is identified as one of your underserved and targeted communities where it's very important that people get vaccinated. And so as you can see, folks do want to get vaccinated. And so we are grateful that we're able to provide this service in our community.
Southeastern Virginia Health System and Hampton Roads Community Health Centers have partnered to provide primary care for you and your family.
Accepting all patients, whatever their insurance status. We're your patient-centered medical home. In office, online, or via phone. We're dedicated to safely meeting your healthcare needs.
Throughout Hampton Roads, wherever you live, work, or play, we provide high-quality, comprehensive, and affordable services.
Because we care, so you can be healthy.